Insurance companies are masters, and I can assure you they're masters of propaganda. I was a part of that game for a long time until I didn't have the stomach to do it anymore. What is referred to, or what is legally Part C in Medicare, is a private program operated by private insurance companies. Medicare Advantage is not Medicare, and it should not even be called Medicare or Medicare Advantage.
We're looking to take action and build a better healthcare system. Wendell, with that, I'll turn it all over to you.
Thanks so much, John. I'm a former journalist. Not a whole lot of people know that, but I was a reporter in my home state of Tennessee, in Memphis and Nashville, but ultimately in Washington, where I covered Congress and the White House for Scripps Howard newspapers. This was back in the 1970s. I had a longer career in corporate communications. I ultimately led the communications departments at two big insurance companies, Humana and Cigna, where I rose up to the ranks to become vice president of corporate communications. But I left that career after a crisis of conscience, and because of what many people have, and became what many people have called a whistleblower. I testified before Congress several times during the debate on what became the Affordable Care Act. This is how I introduced myself to the Senate Commerce Committee. My name is Wendell Potter, and for 20 years, I worked as a senior executive at health insurance companies, and I saw how they confuse their customers and dump the sick, all so they can satisfy their Wall Street investors. During that hearing, we didn't talk about Medicare Advantage. It wasn't the big topic of the day, and relatively few people were enrolled in Medicare Advantage plans back then. But I can assure you that what is going on now by these big companies is an attempt, and a very successful one, to satisfy Wall Street investors. I probably would not have had that crisis of conscience had I not been a journalist and a journalism major in college and a newspaper reporter for several years. And I wouldn't have had an understanding of how easy it is to manipulate public opinion and the opinion of lawmakers and mayors like Mayor Adams and Mayor de Blasio before him. Had not one of my journalism professors required his students to read a book that was published when I was just 3 years old. The name of that book was How to Lie with Statistics. As author Darrell Huff wrote in the introduction more than 7 decades ago, and it's just as appropriate and apt now as it was then, maybe even more so. He wrote that the secret language of statistics, so appealing in a fact-minded culture, is employed to sensationalize, inflate, confuse, and oversimplify. Statistical methods and statistical terms are necessary in reporting the vast data of social and economic trends, business conditions, opinion polls, the census. But without writers who use the words with honesty and understanding, and readers who know what they mean, the result can be semantic nonsense. This book is a short primer in ways to use statistics to deceive. It may seem altogether too much like a manual for swindlers. Perhaps I can justify it in the manner of the retired burglar whose published reminiscence amounted to a graduate course at how to pick a lock and muffle a football. The crooks already know those tricks. Honest men must learn them in self-defense. Folks, there is no shortage of crooks and swindlers when it comes to Medicare Advantage. And they know the importance of having likable and credible people serve as their spokespeople, and how to use and slice and dice data to their advantage. Just last week, George Halverson, who's the former CEO of Kaiser Permanente and the current chair of an organization called the Institute for Intergroup Understanding, posted this on LinkedIn. JAMA just did a multi-year study that showed Medicare Advantage with higher quality in all 8 quality measures and 40% fewer hospital admissions for asthma and a 40% lower death rate over 4 years compared to fee-for-service Medicare. The data is pouring in that proves the value. Medicare Advantage will be universally seen as the better model by everyone in the country by year end. This was in December. Upcoding can't happen for Medicare Advantage when they actually completely and entirely eliminated the coding system itself for 2022, gone entirely. And that is not true. The JAMA data in the December report reinforces a lower Medicare Advantage death rate. We need to get as many low-income people as we can into special needs plans, because otherwise they are going blind and losing limbs. And then he linked to an article that presumably was a legitimate study. And then he said, that's very powerful and very real and relevant data. Share the link if you can. Have a great year. There's so much wrong with that. And especially coming from someone who is as prestigious and regarded in healthcare and health policy as George Halverson. It's just a real travesty, but it just shows you how people can be co-opted. Now, if every company operated Medicare Advantage plans like Kaiser Permanente, where he worked for a long time, we wouldn't have as much of an issue, but that is not the case. Last year, more than 80% of all the people who enrolled in Medicare Advantage plans enrolled in one of 3 or 4 for-profit health insurance companies' health plans. These plans have become insurance companies' cash cows, as I've written quite a bit about. And by the way, I write a lot on a Substack newsletter that I invite you to subscribe to. It's free. You can donate if you like. It's wendellpotter.substack.com. And you'll see some of the things that I've written about over the years. Now that study that George Halverson cited, that he said JAMA did, first of all, JAMA didn't do it. JAMA is a publication that publishes the work of researchers, and it wasn't JAMA either. It was an affiliated publication called JAMA Open, Networks Open. And if you look at the study, you'll notice that those 8 measures he mentioned were measures chosen by the researchers. And guess who those researchers were? Every single one of them worked for United Health. United Health Group is the largest private insurer in the country and the largest operator of Medicare Advantage plans. If you look at the conflict of interest disclosures, you'll see that Dr. Cohen, the lead author, reported being a full-time employee and owning stock in United Health Group during the conduct of the study. Another doctor who was there reported being a full-time employee and owning stock in United Health Group during the conduct of the study. Another researcher reported being a full-time employee and owning stock in United Health Group. So you see what I'm saying? These companies, this should not have even been permitted to be published. But not only was it published by a prestigious publication, but you've got someone who is credible, like George Halverson, out there trying to make people think it is research that people should embrace and not question. And that is the problem. That is the root of the problem that we have with Medicare Advantage. Insurance companies are masters, and I can assure you they're masters of propaganda. I was a part of that game for a long time until I didn't have the stomach to do it anymore. The fact is, Medicare Advantage is neither Medicare nor is it an advantage for most people who join these plans. You can't, in the fall, go a day without seeing commercials on TV, opening the mail if you're Medicare eligible, seeing ads all over the place for Medicare Advantage plans. This goes back to 2003, during the Bush administration, the George W. Bush administration, when Republicans controlled both houses of Congress. They passed a bill called the Medicare Modernization Act, and that created what is referred to, or what is legally, Part C in Medicare. But it is a private program operated by private insurance companies. It is not Medicare. Medicare is involved only by shipping money to these big insurance companies to manage the membership or the enrollment in their plans. It is absolutely not traditional Medicare. And people are unaware of that. The advertising specifically obscures important information. You do not hear that they're operated exactly like private insurance plans and all the features that are most problematic to most people. One is prior authorization. In traditional Medicare, the government-run program that's been around since 1965, there is scant prior authorization. In other words, doctors still are able to treat their patients without having an insurance company planted between them and their patients. In Medicare Advantage, that's exactly what is happening. Insurance companies are right smack dab between a doctor and his or her patients. And they call the shots. They can overrule, and often do overrule, a decision or a request by a doctor. And as a consequence, many people who are enrolled in these plans simply do not get the care that they need. And most people who are in these plans don't realize that they have the option of appealing a denial. And insurance companies know this. It's baked into their finances. They know that the vast majority of people are so confused and just take that as a final answer without appealing. But if they do, for those who do appeal, and know this, if by some chance you ultimately wind up in a Medicare Advantage plan, know that you do have the right to appeal. And if you do, there's a very high percentage that you will get the procedure covered that your doctor says you need, or the drug covered that your doctor says you need. The other thing that's important to understand about Medicare Advantage, one of the other shortcomings that you never see mentioned in the commercials, is that they have a very limited, in many cases, a very limited network of doctors and providers, of hospitals and outpatient clinics. And in many cases, the network is so limited that people just simply are not getting good quality care. My mother was an example. She was enrolled in a Medicare Advantage plan. And when she broke her hip and needed skilled nursing care for a while and rehab, the facilities that were available to her in her town were very scant. And none of them were highly regarded, highly rated. I was able to disenroll my mother from Medicare Advantage, and she went back in for traditional Medicare. But that is not really an option or affordable one for most folks, because if you find yourself in a Medicare Advantage plan and find out what the restrictions are that you never hear about in these advertisements, it's not so easy to switch back to traditional Medicare. You will find it very difficult in many cases to be able to afford a Medicare supplement policy. Now, traditional Medicare is not perfect. We need to spend time, and policymakers need to focus on improving the traditional Medicare program, because out-of-pockets are high. They were, the program was created back in the mid-60s, and they were kind of modeled after the prevailing private plans of that time, which had a 80-20 rule. In other words, insurers would pay 80% and leave you on the hook for 20%. Back then, that wasn't nearly as much of a big deal as it is now, because healthcare prices were far lower. Now, 20% of any kind of medical care can be extraordinarily expensive, even for medications, as you all know. So most people who are in traditional Medicare buy a Medicare supplement policy. They are sold by private insurers. But if you can do it, if you can afford it, it's really worth the money. Medicare Advantage, if you're enrolled in a Medicare Advantage plan, a Medicare supplement policy is off limits. And like I said, if you find out that you at some point need or want to move back into traditional Medicare, you can find that it would be very, very costly for you to do so, because if you don't enroll in a Medicare Advantage, excuse me, a Medicare supplement policy when you become eligible at 65, then insurance companies will go through underwriting, which means that they will assess your medical condition, your health status, and they can charge you a lot more money than you would be charged if you enrolled in the Medicare supplement policy when you were first eligible for it. So in so many ways, Medicare Advantage is not Medicare, and it should not even be called Medicare or Medicare Advantage. In fact, two members of Congress, Mark Pocan of Wisconsin and Ro Khanna of California, introduced a bill last fall that would prohibit these companies from even using the word Medicare. Medicare Advantage has become the big cash cow for big insurance companies, and it is why you see these advertisements so often and so relentlessly. United Healthcare, which I mentioned earlier, the biggest health insurance company, which, by the way, as you know, has a marketing agreement and a partnership with AARP to sell both Medicare supplement policies and Medicare Advantage plans. Over the past 10 years, United has grown to be a massive, massive company. It is number 4 now, number 5, I think, on the Fortune 500 list of the biggest American companies based on revenue. The enrollment in United's health plans has been exclusively, entirely in the Medicare Advantage program. If you look at the enrollment in United's commercial plans or employer-sponsored plans, individual plans for people under 65, you'll see that they actually, at the end of last year, insured about 400,000 fewer people in those plans than they did in 2012. All of the growth, every single one of their new enrollees was in a government program, and it's primarily Medicare Advantage. So that's what's going on, guys. These companies have figured out how to game the system, how to game the Medicare Advantage program in ways that brings them enormous amounts of money. Not only are beneficiaries finding it difficult to get the care that they need because of the barriers that insurance companies have erected that stand in the way of them getting the care that they need, but they have figured out how to manipulate the system to get overpayments from the federal government. And that means from us, folks. It's not the figure Uncle Sam, it is our money that we're talking about here. One estimate last year by MedPAC, which advises Congress on the Medicare program, said that the federal government overpaid Medicare Advantage plans $12 billion in 2022. That's just 1 year. It is, in my view, the biggest boondoggle in American history and represents the biggest transfer of wealth from regular people, working folks, to rich executives and already rich shareholders.
Yeah, they work really hard to confuse us with all these different plans, and it's a quagmire, and then the name itself is misleading, and they did this on purpose. Like, we can all see that.
I have one other addition. One of the ways that Medicare Advantage skims the system and robs all of us is that it pays on a per capita basis, not a fee for service. And what they do is they incentivize doctors to cut medical care because they tell doctors that if they spend less than what the per capita is, they can keep some of the excess. So, and they skim some excess off for profits. So it's an incentive system to push medical care down and to reap profits. So that's an important thing to keep.
I was enrolled against my will in an ACO. I was not asked. I was just enrolled in an ACO, which is another kind of reach program, which is the same thing as privatizing Medicare. So we have to keep our eyes open for that as well, I think.
Yeah.
You're exactly right.
Anybody else?
I have a question to Mr. Wendell, John. Mr. Porter, I am curious in terms of what advice would you give us, the regular organizers in the streets, to counterattack the narrative of our union leaders? I'm pro-labor, but at the moment that we criticize all the moves that have been made by the top 4 leaders of the MLC in the city of New York, we're labeled as anti-labor people and chastised, and their narrative is the one that prevails. So do you have any advice for us?
I would say that in a carefully worded way, you can say that unfortunately, some of the union leaders are just out of step with the needs and demands of the rank and file members. We saw something happen actually in Nevada. You may recall during the presidential primary season, one of the big labor unions in Las Vegas came out against Medicare for All, specifically saying that members should vote accordingly and not vote for candidates that supported Medicare for All, for example. Well, despite all the effort, it was a culinary union, all of that, union members disagreed with management and voted significantly in large numbers, and Bernie Sanders won Nevada. So I guess the message here is that say that the union should have the rank and file's best interest in mind, but they too are not immune to propaganda, to misinformation, and that you're working to inform and persuade union leaders about what the membership really wants and needs here, and that frankly and sadly, leadership in some cases is just out of step and not doing that, not representing the rank and file in an appropriate way. Now, that may be not the exact language, but that's the message that I would send, that you want to work and you expect that the union leadership to pay really more attention and to listen to the opposition here.
Thank you so much.
Many people say, and I think this is where people are stuck. The union is saying, we can't afford it. This is the best we can do for all our members, retirees, as well as current members, and that they're really doing the best that they can, and that they don't have the money. What do you say to that?
I would say that they should look more closely at what they're proposing as a solution. If that is the case, and current workers, unions certainly play a vital role in representing the interest of workers in negotiating health benefits, but they have been, as companies have been, very, very ineffective in negotiating better benefits for current workers. Insurance companies have had their way with employers and unions over the years. Certainly unions note that one of their big responsibilities is to negotiate on behalf of workers for health benefits. But look at the track record. Have they been really successful in dealing with big insurance companies to hold down premiums and out-of-pocket costs? And I would say that if you look at it, the evidence is pretty clear. They may have put in a good fight, put in a good effort, but the House always wins here, and the House is insurance companies, and they have been making money hand over fist, whether your benefits come through your employer or in some way through a union. They have just been completely ineffective. Insurance companies not only have been ineffective, they don't want to hold down healthcare costs, because as healthcare costs go up, as hospital prices go up, as drug prices go up, they are just demanding more and more in premiums and forcing unions and employers to shift more and more of the cost to workers in out-of-pocket costs. It is in the insurance industry, there's a term for this. It's called benefit buy down. It's been going on for decades. If you look at if the value of what a health benefit plan was in a union 10 years ago compared to what it is now, look at what the premiums are, look at what the out-of-pocket obligations are, and you'll see that benefit buy down has been at work. The value of your benefit plan is less now than it was 10 years ago, but you're paying more for it. And I think you just have to have plain talk like that.
Wendell, you mentioned before that even corporations are seeing through what's happening, that even what are some of the solutions that you suggested and that others have done to actually save money and yet keep high quality healthcare?
A lot of employers are beginning to realize they don't have to work with Uniteds and Cignas and Aetnas of the world. There are options. There are other health plans that are focused on quality care, and they are available to them. You do not have to construct a benefit plan that saddles workers with high out-of-pocket costs. But employers, benefits managers have stayed in the game with insurance companies because of relationships, because of gullibility, for many reasons. And employers are just not, to a large extent, figuring out that there are other options. In April of 2021, this organization called the Purchaser Business Group on Health released a survey of its membership. And this organization represents Apple and Amazon and Walmart, all the big employers that have operations in this country, especially on the West Coast. And 90% almost of those CEOs that were surveyed said that the cost of healthcare was becoming, or offering benefits to their workers would be unsustainable in 5 to 10 years. And that is happening. Increasingly, employers are getting out of the game. Just 10 years or so ago, about 69% of employers offered benefits to their workers. Now it's around 50% or below. So employers, small ones and mid-sized ones, are just getting out of the game unless they are legally required to offer benefits. So you're seeing an erosion of benefits in the workplace. And one other thing I'm trying to do is work with employers to see the light. I lead an organization, a nonprofit called Business Leaders for Healthcare Transformation. And part of the work of that organization is to get employers not to be gullible and to look at this in a different way.